Jacksonville, Florida. I want to shoot a quick video today. We just ran an Instagram contest and we gave away a gift card to whoever would ask us a certain question that we could answer on the video. Fun for First Coast Kids was the winner, and the question that they asked was, what is the best chiropractic technique for late-term pregnancy? Which is a very good question because a lot of mothers really want to know if they are able to get chiropractic care when they are pregnant, because pregnancy causes a lot of low back pain. First and foremost, I want to inform everyone that there are no contraindications to chiropractic treatment when you are pregnant. Okay, so feel free at any time to go to your chiropractor or anybody to get adjusted. There are no contraindications that will cause trouble with your pregnancy or with your child. Okay, the best techniques to use when you're pregnant are, obviously you want to be a little more gentle. Okay, there's also a technique called activator, which is an instrument that is, it's a click. There's no twisting or cracking. What that does is it's a little more gentle adjustment for people who are a little concerned about their child or they don't like the cracking. Okay, so that's an option that you can use to when you're pregnant to be more gentle, but you not necessarily have to do that. The only thing that you need to be concerned about when receiving chiropractic care when you're pregnant are prone type adjustments, meaning laying face down on the table. Obviously, by doing that, you can put pressure on your belly, put pressure on your child, and with someone thrusting down, that might be somewhat of a concern, but nothing to be too worried about. A lot of chiropractors have tables that flex down, so your belly is allowed to hang down and there's no pressure on your child. Okay. One thing we want to think about is when we're pregnant is you have that influx of hormones and coming into the body, because you're helping the kid grow and you're helping the child develop correctly, so the body knows that it needs to influx those hormones. The only concern when influxing those hormones is it can change the ligaments and it can make ligament laxity. By doing this, it changes the curve of your spine. It also, when you're pregnant, it changes the center of gravity of the body because you have your bellies tend to come out, pulls you forward, so you're putting more stress on the low back. You're also putting more stress on the pelvic muscles and the pelvic ligaments. And when those ligaments stretch out, you're more prone to herniating discs, or you're more prone to injury. So actually, when you're pregnant, chiropractic care is very key to maintain that spinal alignment. Not only maintain the spinal alignment, but to make sure that the nervous system, which goes to every vital organ in the body, is functioning optimally. Because you want to function optimally so your child is receiving those nutrients and receiving a good blood supply so they're able to develop into the potential that they need. Okay? Another technique that can be used that's very effective in pregnant women that addresses the pelvic issues, addresses the sacrum, is what we call the Webster technique. What the Webster technique does is it evaluates the alignment of the pelvis. You apply adjustments to the pelvis, and you also work the ligaments to help relieve that pressure in that area. Okay, this is very important again because you're changing the curve of the spine, you're changing center of gravity, so you're putting more pressure on that pelvis as well as you're adding additional weight. Okay, another good adjustment for the pelvis is a drop table. So what you do is laying down, face down, and the table will drop underneath the pelvis. This will also allow to align the pelvis, take some pressure off the low back, take pressure off the knees and ankles and such. So those are just quickly a couple of techniques that will help out when you're in late-term pregnancy. And again, there's no contraindication, so don't be hesitant to go to your chiropractor if you're in pain, because chiropractic can really help you through that process and allow for your pregnancy to be more comfortable. And chiropractic not only makes you comfortable, but it will also allow the nervous system to function properly and the blood supply to flow freely to allow for your child to develop optimally. And that's what we really want to be concerned about. We want to make sure that the mother is comfortable as well as the child is developing properly, and that can be done with chiropractic care. So if you have any other further questions, please visit our website at www.elevatejacks.com, or you can also visit our YouTube channel, Facebook. Get involved with us, send us questions. We love replying to our followers. And until next time, this is Dr. Lowry with Elevate Health Center in Jacksonville, Florida.